Welcome. It's my extreme pleasure to serve as a moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the work and all of the projects undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today, and I see that people are continuing to join the webinar, so let's give them another few seconds and we'll get started. I want to thank you all for joining us today, whether you're joining on GoToWebinar, Facebook Live, and YouTube Live. Due to the large number of participants joining us on GoToWebinar, everyone has been placed in listen-only mode. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering, so I hope you plan on joining us each week. Our objective in all of our Ask an MS Expert programs is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind. As I chat with our expert today, please feel free to post your questions and your comments as they come to mind on Facebook and YouTube, or type them into the questions box if you're joining us on GoToWebinar. I have a helper working behind the scenes with me today. Julie Field is ready and waiting to capture your questions while I'm busy talking. We'll answer as many of your questions as we can during the Q&A portion of today's program, so I hope you're ready to participate. And I know many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll be sure to let you know how you can reach an MS Navigator before the end of today's program. And if you're interested in reviewing any of today's conversation with our expert, this webinar is being recorded and it'll be available on the Society's website for your reference. COVID-19 is going to continue to be a hot topic in all of our lives for the foreseeable future. So we're going to continue providing you with the latest updates on what the experts are learning about COVID-19 and MS. Today, we're also going to be discussing what you need to know about staying healthy with MS during the pandemic. And of course, we're going to spend time answering your questions. And we'll share some key resources that you can turn to for credible, reliable information about COVID-19 and MS. And before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer to review. COVID-19 is a new coronavirus, and limited published data is available about this virus and MS. The information and recommendations presented in this program are based upon the individual professional opinion of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. Now let's meet our expert. Dr. Ellen Mowry is a professor of neurology at Johns Hopkins Medicine. Dr. Mowry became interested in multiple sclerosis prior to beginning college and first performed MS research as an undergraduate biology major at Georgetown University. As a neurology resident at the University of Pennsylvania, Dr. Mowry began her MS clinical research activities, conducting a study of visual dysfunction and quality of life in multiple sclerosis. During her fellowship at the University of California, San Francisco, Dr. Mowry evaluated prognostic factors in multiple sclerosis and examined health-related quality of life in MS, particularly as a marker of disease burden. She also earned a master's degree in clinical research at UCSF. Dr. Mowry joined the Johns Hopkins Department of Neurology in July 2011, and over the past several years, she's performed epidemiologic investigations of multiple sclerosis risk and prognostic factors, and has evaluated both genetic and environmental contributors. While she has had a major role in several studies, Dr. Mowry's most significant work led to identifying the association of vitamin D status with relapse and brain lesion risk in patients with MS. She also conducted the first pilot study comparing gut bacterial populations in patients with MS and healthy individuals. Dr. Mowry enjoys designing and conducting clinical trials in MS, and she's the principal investigator of the Vitamin D to Ameliorate Multiple Sclerosis multi-center vitamin D trial, which is being sponsored by the National MS Society, as well as a smaller multi-center pilot study investigating vitamin D pharmacokinetics in MS patients and healthy controls. Dr. Mowry is also the recipient of a Harry Reaver Award from the National MS Society, where she's investigating the impact of intermittent calorie restriction in MS. Finally, as director of the MS Experimental Therapeutics Program at Johns Hopkins, Dr. Mowry assists her colleagues with study design and helps oversee the conduct of MS clinical trials. Thank you for joining us today, Dr. Mowry. We're now going on week number 10, and we're committed to keeping everyone updated on the latest news about COVID-19 and MS. Last week, we covered information on the status of COVID-19 vaccine research, emerging information about how some MS drugs are being used in combination with antiviral drugs as treatments for COVID-19, the data being collected from people with MS who have gotten the virus, and how COVID-19 seems to be affecting children. Dr. Mowry, I know you've conducted a considerable amount of research focused on vitamin D and its relationship to MS. And over the past few weeks, we've received several questions about vitamin D and its impact on MS, and most recently about how vitamin D might impact the COVID-19 virus. For example, we heard from Karen, who wrote, "I've been hearing a lot about how high levels of vitamin D make dealing with COVID-19 easier. Is that true?" And Denise is asking, well, how does vitamin D affect COVID-19? So before we talk about what we know about vitamin D and its impact on multiple sclerosis, let's start with COVID-19. So what do we know so far about the impact of vitamin D on the COVID-19 virus? Should people start taking a vitamin D supplement or increase their vitamin D supplement?
Thanks, John, and thanks to both the National MS Society and to yourself for hosting me today. These are really important questions. What we know so far is from large observational studies, meaning not studies where people kind of flipped a coin and some were given vitamin D and the others weren't, and we look to see whether that vitamin D supplement helps reduce the risk, say, of COVID-19 or reduce the risk of more severe disease. There were a lot of early reports suggesting that people who were testing positive for COVID-19 did happen to have much lower levels of vitamin D than those who weren't. And so that's sort of where the question about vitamin D and its role in the risk of COVID-19 or potentially even in its prognosis came up. I think studies are still a little bit early. One of the complicated things about checking vitamin D levels in people broadly is that vitamin D levels are also related to other factors that do appear to play a role in the COVID-19 pandemic. So for example, people who carry extra weight, who suffer from obesity, are more likely to have lower levels of vitamin D. And so when you study just vitamin D, for example, and look for its association with an infection, but you aren't accounting for, say, a person's body mass index or weight, you might be kind of observing what appears to be a relationship between vitamin D and the risk when it's really related to something else. I think another strong example relates to skin color. We know that people who are Black or African American or have more skin pigment naturally have lower levels of vitamin D because most of us end up getting our vitamin D from the sun. And people who have more pigment in their skin have less UV transmission in their skin, and it's that ultraviolet light that helps start the process of converting pre-vitamin D in our bodies into the more active form. So there's a lot of complexity because we unfortunately know that people who are Black or African American seem to be at a higher risk of getting coronavirus as well, and in addition, maybe having worse outcomes. So I think the jury's still out. Fortunately, from a study and rigor perspective, there are a number of ongoing clinical trials that are incorporating vitamin D as a treatment for COVID-19. So we'll definitely learn to some extent how helpful that is. In the meantime, I'd suggest that people kind of speak, of course, with their neurologists. Many people with MS elect or are advised to use vitamin D supplements as part of their MS care. Whether or not that's completely justified, I think the jury is still out. But we do know that taking too much vitamin D is harmful. It's not a vitamin that just sort of leaves your body through natural processes. So we don't systematically recommend that people just start adding a whole bunch of vitamin D in hopes that it would protect them from COVID-19. It might be useful to talk with either your neurologist or your primary care doctor, see kind of where your levels were if checked on your prior vitamin D supplements. Potentially check them if you're getting blood work anyways, and think about the pros and cons of supplementing.
I'm wondering if you've heard any recent news about potential treatments for COVID-19.
Yeah, there's a lot going on for sure. It's been sort of unprecedented in many ways, the amount of attention that's been focused on COVID-19 by the media, and it seems like almost any like any treatment that's potentially exciting becomes the object of a lot of discussion. And I think it's in part realistic, right? Because we're all terrified. We haven't seen something like this in our lifetimes anyways. Some of the things that people thought of early on as potentially helpful seem to have been debunked. Most other treatments are still kind of in clinical trials. There was an antiviral therapy that appeared to have a small treatment effect. I think we need some more investigations of that to be sure. And then there are additionally many, many other treatments that are of course being studied, not only just the medication treatments, but also simple protocols like positioning people in their beds if they're hospitalized to sort of optimize their breathing, things that we normally don't think about as much as potentially as a treatment, but that in fact doctors are reporting seems to have some benefit for their patients. So the good news is that a lot of universities have really prioritized and focused a lot on coronavirus research. They have kind of sped up the degree with which they review protocols to try to improve understanding and knowledge. And of course, a lot of funding for that research has been opened up, across the world, and especially in the US, I think for trying to understand treatments as well as risk factors.
While we're talking about treatments, we've heard that some MS treatments are being tested as potential treatments for COVID-19. Why are these MS treatments good potential candidates, I guess? And should someone already on a disease-modifying therapy switch to one of the treatments being tested for COVID-19?
Yeah, it's fascinating. When the pandemic first hit in the United States, I know we neurologists and people living with MS and others became really worried that perhaps their treatment would put them at increased risk of getting the coronavirus infection or, of severe outcomes. And then a few weeks later, you realize that people are actually trying some of these therapies in individuals who have already been infected. So things are definitely all over the map. The rationale for studying some of those therapies in individuals who have already been infected with coronavirus 19 is that we think that there are many people who get infected and have either no symptoms or very mild symptoms, but that the people you're hearing about on the news who are having very severe disease and this sort of delayed disease where things get really bad and they're in their hospital and they're having many multi-organ complications and things like that, that appears to be mediated by overactivation of the immune system. People with MS know about overactivation of the immune system and other autoimmune diseases as well. And so the notion of trying medications that temper that overactive immune response, including medications that are used traditionally for illnesses like MS, is that perhaps by modifying or cooling off that immune response a bit, it may prevent some of the severe systemic complications caused by the virus. So there are many medications and trials from the MS side of things. Certainly fingolimod has been in trials. A medicine that's similar to teriflunomide has been in trials. Interferons have actually been in trials, and that makes some sense in other ways too. For example, it's long been thought that certain interferons actually help your body clear viruses. So many people in the MS research and neurology community were wondering if people on interferons would in fact do better because of their interferon treatment. So, one of the things that I think is really interesting in general about this pandemic as it pertains to MS and research in people with MS is that it's actually brought the community together a lot. There have been national and international calls of sort of the top experts really trying to put their heads together, thinking about not only the pandemic broadly, but how it pertains to people with MS. And then what kind of data can we gather from people with MS that might help us understand the virus more. So this is a great example. The COVID study that's co-sponsored by the National MS Society and the CMSC and other international efforts, really pooling together data from people with MS who unfortunately have gotten sick, as well as larger cohorts sort of studying the people in real time and kind of thinking about what medicines they're on and whether the outcomes are different by medication, I think will be really useful.
Tabitha asked if we know why some people who get the virus continue to suffer from symptoms months after their initial diagnosis, and should people living with MS anticipate also having to deal with an exacerbation or worsening of their MS symptoms if they do contract COVID-19?
Yeah, Tabitha, that's a really great question. Always interesting that there are certain global infections in our bodies that seem to linger. And I think this particular virus, perhaps in part because it's all coming at once and everybody is getting sick in a relatively short period of time, is a somewhat extreme example of that. But there are many infections, I think, that leave people with a very prolonged sense of not feeling well. I mean, many people with MS report, for example, a prior history of Epstein-Barr virus or mononucleosis infection, which is thought potentially to be related to risk of MS. And, people, again, with that virus feel very sick for weeks and weeks. And so I think that we don't fully understand why, even after, the fever cools down and seemingly people theoretically should be feeling better, that we don't. I think we are also kind of learning from a neurologic perspective a lot about and trying to study a lot about the longer term effects of the virus. I was hearing on a call yesterday, for example, that even people in the hospital who don't present with any focal neurologic problems in their movement, say, or their talking, who happened to get an MRI scan of their brain showed new changes in their brain structure that apparently are related to the virus. So there may be damage that in the intensity of an intensive care unit setting where people are just concentrating on keeping people alive and giving them enough oxygen and things like that, we're kind of overlooking some of the subtle effects or not even measuring all of the subtle effects on the body. And I think there are places, including at Johns Hopkins, where they are setting up very multi-center or sort of multifocal collaborative care models for people who are recovering from coronavirus. And in that context, we'll be kind of looking at the long-term impacts on several organ systems, including the CNS. The MS specific question is really intriguing. Prior studies of people with MS have demonstrated mixed effects of infections in terms of risk of getting a true exacerbation, which sometimes means something different for neurologists compared to people living with MS. So for neurologists, when we're thinking about a true relapse or an exacerbation, we are thinking about new symptoms lasting for more than a day, typically associated with new white spots on the MRI scan of the brain or the spinal cord, because to us that represents new immune system activity causing new damage. That kind of exacerbation has been shown in some older studies in people after the influenza infection. Less so with other infections, although to be fair, it's easier to study things like flu than say a common cold. And also I think important to point out is we're not sure if that association still exists in the more modern treatment era where people are often on stronger medications to suppress MS activity to begin with. So whether getting the flu today means the same thing as getting the flu before MS treatments were available is not super clear. I do think we will expect to see MS, what we call pseudo exacerbations, which can functionally feel like the same thing to a person living with MS, worsening of old symptoms because of the infection, and understanding that that's quite impactful. And then the final point I wanted to make is that coronavirus does appear to affect the nervous system directly as well. One of the most common symptoms of coronavirus infection is actually dizziness. And we are hearing the potential that the COVID-19 infection is associated potentially with an increased risk of strokes as well. So if you're already living with a neurologic illness and you happen to be unfortunate enough to get coronavirus infection, it's just important to remember that not all things are the old illness that you have, particularly if you have sudden or stroke-like symptoms. Be sure to go to the emergency room because there are treatments that can be delivered in a timely fashion. And we've already had a few people, not specifically with MS, who've delayed their emergency room visit, worried about getting sick, but in the end, weren't able to have their neurologic symptoms relieved due to that timeliness factor.
Alfred wants to know what we've learned about using antibodies from people who have recovered from the virus to treat other people who are still battling COVID-19.
Excellent question again. So I think what you're referring to is called the convalescent plasma treatment. So this is the notion that we know that people, after they've had an illness and they recover, part of their recovery phase, they're making antibodies that help to neutralize the infection. Plasma is a component of our blood and it contains antibodies. And so the notion of this is, can we take blood out of a person who's recovered and has antibodies and donate those antibodies to people with an early, ideally, coronavirus infection? And will that help to prevent that more severe disease down the road? And again, this is also being trialed a lot. It's been used with some success for prior viral infections in the past. But I think we don't have definitive data for COVID-19 as to whether or not this has been helpful, and also in what clinical context it's most useful. Many people think perhaps it's better, again, to start kind of in that mild phase to try to prevent more severe disease. On the other hand, many, many more people have mild COVID-19 infections compared to severe, and there are only so many people who can donate plasma. So it becomes tricky to figure out what's the right timing and how do we get sufficient plasma in order to help people get the access to that therapy. Nonetheless, it'll be really interesting to see if it is helpful.
Kate, I think, is taking a more wellness, holistic approach to the pandemic, and she'd like to know whether there are any dietary recommendations or suggestions you can offer to people during the COVID-19 pandemic. Are there specific foods or food groups that people should change, avoid, or add to their diet?
Yep. So again, early in the disease, there haven't been any large trials to say, you should follow diet X, Y, or Z. My interpretation of the diet question so far is pretty similar to what we apply to people with MS in general. It does appear for COVID-19 infection, and I alluded to this a little bit earlier, that obesity may be a risk factor for more severe outcomes with COVID-19. And so we also think about obesity-related illnesses, and some of those have shown a potential for worsening outcomes related to COVID-19, things like diabetes or high blood pressure. So because there hasn't been enough time to do a randomized trial of diet, I always like to backpedal and think, well, what things help to alleviate diabetes or high blood pressure or obesity? And the best data really come in right now in terms of dietary types for basically a Mediterranean style diet. So this is sort of, I would say, what we all know we should be doing anyways, but we're confronted with pizza and French fries and things like that. And so are tempted away. But these are things like, eating plenty of vegetables and fruits. If you're eating carbs, making sure they're more whole grain than sort of the white pasta and rice and things like that. Reducing the amount of sugar sweetened beverages, probably even diet beverages that can create a lot of metabolic strain on the body. And then more poultry and fish compared to intake of red meats. And I would say, we all are going to have cravings and kind of give into some of these things, but just doing the best we can to keep that diet as balanced as possible. And then if you happen to have some of those illnesses already, working carefully with your appropriate doctor or other provider to make sure you're treating your diabetes well and keeping your blood pressure under control, things like that. Again, makes kind of common sense in the absence of good clinical trial data.
Dr. Mowry, as states and local communities are starting to open back up, we know how critical it is for everyone to continue wearing a mask in public to help prevent spreading the virus. But it seems that not everyone appreciates the difference wearing a mask can really make. Can you help us better understand the importance of wearing a mask now and in the immediate future?
Yeah, I think it's been challenging because initially it was not clear exactly how the virus was transmitted from one person to another. Is it likely that it's sort of all over the surfaces, that somebody just vacated in the grocery store and you touch something and then it you're infected, or does it come in the air, and if so, like how close can you be, and that sort of thing. It does seem for the most part that the virus is transmitted in the air. A lot of it is transmitted in what they call larger droplets that tend to fall very quickly to the ground, and some of it may be in smaller particles that kind of stick around a little bit longer. It does seem quite clear that the transmission is through kind of a respiratory mechanism, though, and in the air. And so wearing a mask is basically our best method of preventing you from inhaling some of those particles, as well as if you happen to be sick and you're not sure, of you transmitting those particles out to other people. And you can imagine that if everybody is very cautious and wears that mask, covering your nose and your mouth, that it's less likely that any particles will be in the air, period, both from transmitting accidentally outward as well as inhaling them in. And then, hand washing, obviously common sense. It can be really awkward for people who aren't used to wearing masks, and I'm sure all of you who've been out understand this now, to not kind of touch it or adjust it. So just be really careful when you're taking it on and off, and remember, if you do need to get there or you have a scratch, wash your hands first, just to be clear that you're haven't accidentally touched some droplets that are now getting in there.
Well, I'd like to shift gears and talk about staying healthy from home. And before we dive in, I just want to acknowledge the viewers who have continued to join us today on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions in Facebook or YouTube, or type them into the questions box if you're joining us through GoToWebinar. We'll be getting to more of your questions in just a moment. Our weekly Ask an MS Expert webinar takes place every Friday, so please be sure to share this news with your friends and family. Dr. Mowry, throughout these weekly webinars, we've been hearing from people who want to know more about diet, vitamins, and exercise that can help keep them healthy while living with MS and with the added stressors of life during the pandemic. We've heard from many people, like Janine last week, who said she likes seeing that the impact of diet, vitamins, and physical activity on MS has been coming up more often. And Janine would like to hear more about studies and outcomes on the topic. We also heard from Denise and from several others, actually, who specifically want to know about gut bacteria research. So I thought first we could get back to the work that you've led on understanding the connection between vitamin D and MS. Can you tell us about the research that you've done and share a little about what you've learned?
Absolutely, and not to be biased, but I agree with Janine. I love thinking about how people living with MS, in addition to kind of thinking about their MS-specific medications, might benefit from better research to think about how day-to-day activities that we have the opportunity to control might improve the long game of living with MS as well. Yeah, so vitamin D, I guess, has been a highly exciting area of MS since the mid-2000s, when some early work suggested that low vitamin D levels may be associated with increased risk of developing MS. And those studies were done in a cohort in the military, or the best early studies were done in a military cohort. And notably, the cohort really only involved white or Caucasian individuals, which we'll come back to in a little bit. So when I was first studying vitamin D, we became interested in whether it was kind of too late if you were already diagnosed with MS, or if taking vitamin D supplements might be helpful, even if you're already living with the disease. So we first did some studies in kids and later in adults looking at vitamin D levels and whether vitamin D levels early on when we were following them were linked with MS-related outcomes. So in kids, for example, we've measured vitamin D levels and showed that over the course of the next year or two, the kids were with lower levels of vitamin D were more likely to have a relapse. And then in adults, a large cohort study of adults who gave blood samples once a year and were having annual MRI scans of their brains, we also saw that lower levels of vitamin D were associated with an increased risk of developing new MS spots in the brain. That still doesn't mean that taking supplements will help, though. There's always the chance that it's something about people with low vitamin D levels that we're not measuring that could be causing that apparent association. And so recognizing that, we and some others applied for funding to do clinical trials of vitamin D supplements in people with MS. There have been a couple studies in Europe that have been completed, and ours is almost done. The European studies added on vitamin D supplements in very high doses to a platform MS therapy, the interferons. And unfortunately, they did not show a very meaningful effect of vitamin D supplements in those populations. So there are a number of potential explanations. One is that vitamin D supplements actually aren't that helpful. The other explanation is that it's also possible that they kind of chose too high of a dose. You know, you've always heard of everything in moderation, or too much of a good thing. And if you kind of give too much, it may not be good. It may start to have some untoward effects. Our study is looking at a more modest dose of vitamin D as an add-on to glatiramer acetate, one of the older injectable medications for MS, and as mentioned, should be out soon. So we're really interested. Going back though to thinking about, are we measuring the right thing at all? There have been some recent papers suggesting that in modern groups of people living with MS, the linkage between low vitamin D and MS risk is not equal among races. So for example, Annetta Langer-Gold in Southern California Kaiser showed that, yes, although low vitamin D levels appear to be linked with MS in white or Caucasian people, as was studied in the past, Black or African American individuals or Hispanic Latino individuals don't appear to have that relationship. And so I think it's important to reflect on, what does vitamin D represent? Does it mean the same thing in all people based on their genetic or other backgrounds? So the jury's still out.
I'm wondering, are scientists looking at other vitamins and their association with MS?
Yes, to some extent. It's hard to convince funding bodies that something as mundane as a vitamin might be relevant to study. People really like fancier ideas than that, and to some extent. There is some work that's gone on looking at vitamin A and its potential link with MS risk or prognosis, and whether supplementation could be helpful. I believe there's one clinical trial, maybe more, going on overseas looking at vitamin A supplementation. Not exactly a vitamin, but also related to nutrition. There's always been a lot of interest in fatty acids and PUFAs, omega-3 fatty acids and other things like that. And there have been some recent publications, again, looking at dietary components, suggesting that omega-3s in particular, or fatty fish, which contain a lot of these healthy fatty acids, might be protective against risk of MS. Again, moving forward to understanding, well, if I'm already living with MS, is that helpful or not? I think the jury is still out. Those types of fish are kind of a central component of that Mediterranean diet we spoke about. So in the absence of MS-specific data and in focusing on health in general, hopefully people can follow some of those guidelines and kind of have a well-balanced vitamin repertoire.
What can you tell us about research on the gut microbiome in MS? And why is understanding gut bacteria important?
Yeah, so the bacteria in our gut comprise a lot of the work that's being done in order to absorb those important nutrients, but also other things. The bacteria in our guts are part of what educates our immune systems about what belongs inside your body and what is not part of your body. And so there have been a number of disorders linked to alterations in the gut bacteria. And are those bacteria kind of miseducating the immune system, and then the immune system kind of goes haywire in some of these autoimmune diseases? There have been a number of studies looking at the composition of the bacteria in our stool, comparing that composition in people with MS and people without MS, and have noticed some distinct differences, including as far back as in pediatric onset MS. So presumably with kind of less time to alter it through other mechanisms. Your genetics and exposures very early in life can likewise determine, along with diet, what the composition of those bacteria is. So, some of the studies have shown some similar bacteria or changes, but there's also been a lot of difference from one study to the next. So I think there's still a lot of work to do to understand, like, is there a certain bacterium that's good or bad? Or are there certain types of bacteria and the way they relate to the immune system that might be relevant to people with MS? I mentioned that we're mostly measuring conveniently bacteria that come out of the body in the form of stool, but there are different kinds of bacteria that come out compared to those that are close to the wall of our intestines, where they would be more likely to interact with the immune system. So there have been kind of limited studies exploring those bacteria. And then finally, I think one of the challenges for studying the gut bacteria in people with MS is that, oftentimes we study a group of people who happen to be in the clinic who are living with MS, but many people with MS already have alterations in the way their gut functions, like they're a little bit more constipated. And even just being more constipated can change the upstream bacteria in the gut. So then when you're trying to compare those individuals' bacteria to those of people without MS, are you measuring something that's relevant to the risk of getting MS? Or are you measuring a consequence of MS, i.e. certain bacteria are overgrown because people with MS have more constipation, and thus that bacteria population kind of crops up. So it's a lot to think about. I think a lot of studies are also starting to think not only about how to better analyze that kind of issue, but also to link the bacterial populations in the stool or in the gut with what's actually happening in the human body. And there are ways to sort of understand the dynamics of the bacteria in the gut and to see what kind of fingerprints that those bacteria might be sending out into the human body through a fascinating study of blood byproducts called the metabolites. And you can measure things that are produced by the bacteria in the blood. And to some extent, that might be a really important thing to think about as well, not just what's in there, but how is it influencing things internally. So that was a long-winded way of saying a lot of exciting work going on, challenging scientifically to sort out chicken or the egg. But again, a lot of things tying back to diet, dietary health, and things like that, including the gut microbiome.
Tammy wrote to us saying that she's having a problem getting motivated to exercise at home, and she knows that she won't be comfortable going back to a gym for a long while, even after gyms open up again. How important is it for people living with MS to incorporate exercise into their daily routine? And can you share some tips that would make it easier to stay active while you're at home?
Sure. Yeah. I mean, I think lots of people with and without MS have struggled with this. Major disruptions to their routine, access to exercise equipment for people who require more assistance, just not having physical therapy or other things in place as they're normally used to. So there could be a lot of challenges, and they're not likely the same across all people living with MS. In general, though, we do think exercise is really important. Again, you're not going to see large 20-year randomized trials in people with MS. The randomized trials that have taken place, the shorter ones, though, have demonstrated a major impact for people living with MS with respect to improving anxiety, depression, fatigue, which is a big deal, and improving sleep quality overall. So it almost seems counterintuitive because, of course, just mentally, like gearing up to do exercise, sometimes we all get down in like, oh, all right, I got to do this. But in fact, in these randomized trials, it's actually been shown to treat some of the more stubborn MS-related symptoms. We also know that people who exercise generally are less likely to have diseases of the central nervous system that are associated with excessive dying out of nerve wires, things like Alzheimer's disease in later life. And so I always try, because we aren't going to have these 20-year clinical trials of exercise in MS, to think about, well, how can people with MS protect every single nerve wire they have? And, one way is to say, let's not let any get damaged. Make sure the disease is well controlled as much as possible with MS disease modifying therapies that are appropriately targeted to you. But the second thing is to think about, like, well, in the long run, how can I otherwise protect nerve wires? And so that's why, at least in my clinic, we focus a lot more on complementary effects of maintaining healthy diet and exercise and even good sleep. I think, I think we all struggle with this. We are all human beings, and we all have phases of our lives where, where we can do things that we know are good for our health, and other times where we kind of give up. And there's no easy right answer. I think it may be different for every person. If you can find a buddy to kind of check in with, to motivate you to kind of stay on track, commit to each other to do a certain amount of exercise, that sort of thing, it can be helpful. There are a lot of free exercise videos on the internet, including YouTube, that many people find to be helpful. So those are some ideas. The other thing I think that's important, especially during this pandemic, is the MS related, but sometimes quite insidious or kind of occult depression and anxiety, which can really creep in and might be affecting people without their recognizing it. So making sure, really tuning in to think, is there a component related perhaps even to the pandemic of anxiety or loneliness and depression that might make me feel kind of like, ugh, and not getting up and doing things that we need to do. And anxiety and depression are underappreciated clinically, I think, and undertreated in people with MS. And, they really can impact a person's well-being overall in many ways, including in motivation to do things like exercise. So talk with your doc or other provider to see if they think you might have some depression or anxiety, and again, consider treatment thereof. One thing which is actually exercise.
Well, thanks for bringing us up to date on what the experts are continuing to learn about COVID-19 and MS, and sharing some of the ways that we can stay healthy at home. I'd like to get to a couple of more of our viewer questions. I know we discussed antibodies a little earlier. Now, one of our viewers is telling us that they've been presumed positive for COVID-19, and they want to know if an antibody test is worth getting before starting Ocrevus infusions. What do we know about antibody tests for COVID-19 and how they might relate to starting something like Ocrevus?
Yeah, it's a great question. And the short answer is we don't know for sure. We know that a negative antibody test means you haven't had an immune response to that particular coronavirus. A positive response is a little bit harder to interpret, both in terms of is it definitely protective against future infection, but also there may be some cross-reactivity with prior coronaviruses in the past. So I think we're going to require a lot more time following people who have tested positive by antibody testing to see whether those individuals are in fact less likely to get infected over the longer period of time. As it relates to a person's treatment decision, is really highly individualized. There are a lot of factors that go into understanding whether a person should start an MS medication at this time, which one is most appropriate, and weighing the risks and the benefits thereof. There's been a major trend towards using strong medicines, even as the first therapy for MS, and certainly this pandemic, has caused some anxiety. Some of these multi-site collaborations have not shown definitively some overwhelming signal to suggest massive increase in the risk of more severe disease based on the type of treatment that people receive. But, I think the jury is out a little bit. So I'd say, if you are having concerns, talk to your provider if you haven't talked with them at length, because that's our job. as doctors is to actually help you understand, your treatment decisions and what the best way is to maximize those treatments and to avoid risks. And if you don't get it through the first appointment, make another one. We're here for you, and I don't even understand everything my doctors tell me the first time, and I'm trained in medicine. So, there's a lot of overwhelming information. So I'd recommend doing that and making sure you feel really comfortable with the kind of your risk-benefit ratio.
Excellent advice. Over the last few weeks, we've talked a lot about MS symptoms, and we continue to hear from people about the symptoms that they're struggling most with to manage. Someone contacted us through Instagram, actually, and asked if everyone with MS experiences chronic pain.
Yeah, that's a great question. I would say no, based on my experience as a clinician, as well as reading the literature. But pain in people with MS can be multifactorial. Some people experience what we call neuropathic pain, some of that tingling, numbness type of symptom, and other people have different kinds of musculoskeletal or other pain, and sometimes it is related to MS, the pain of spasticity and tightness, or when our bodies have to compensate for weakness, and thus we start kind of walking in a different way, and that may put strain that's not natural on our joints. It's always important, though, to make sure that the pain person's experiencing is not due to another illness, whether it's just a generic old osteoarthritis or something like that, that many of us get. People with MS, may have other illnesses too, so it can be easy to kind of blame MS, but in reality, they may have another illness, rheumatoid arthritis or some other kind of thing that contributes to pain. So definitely worth kind of checking out. And I'm sorry you're suffering, or anyone really is suffering with pain. And then finally, just much more research is necessary to go into treating pain. We have a lot of medicines that can help with spasticity or neuropathic kind of pain. We do sometimes, reach a limit to what those medicines do for a given individual. So I think it's an active need in terms of research.
While we're talking about pain and how to best manage it, there's an ongoing, fairly loud conversation taking place online for a long time now about using cannabis or CBD for MS. And someone has written in indicating that they've ordered CBD to vape to help manage their spasms and their MS pain and insomnia. And they're asking if, now that they've done this, they're asking if it's recommended. What do we know about the safety of cannabis, and how well does it work for MS-related pain?
Well, I would say, unfortunately, again, data are somewhat limited. I think the data we do have for cannabis-like products demonstrates sort of a mixed effect in people with MS, where some of them have demonstrated an improvement in muscle tightness or spasticity, but other studies have shown, perhaps not surprisingly, worsening of cognition, for example. And so it can be really tricky to understand what the right moves are with respect to trying some of these products. Many of them, or the oils and things like that, are unregulated. And so it's hard to know what's in them and what concentrations and things like that. So yeah, a lot of work to be done there as well.
Well, thank you, Dr. Mowry, for all that you've contributed to our conversation today. Thanks for being with us. And thank you to everyone who's submitted a question or a comment today. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on. So let me first circle back to something I said earlier. If we were unable to get to your questions today, please know that the National MS Society's MS Navigator team is available to answer your specific questions and connect you to the very best resources. And I'm going to share the ways that you can contact an MS Navigator in just a moment. You can always check the Society's website at nationalmssociety.org/COVID-19 for complete updated information on COVID-19 and its impact on MS. And you can visit the Centers for Disease Control and Prevention website at cdc.gov for the latest information about COVID-19 from the federal government. This is our 10th Ask an MS Expert webinar. And if you'd like to review any or all of the past webinars, as well as this one, you'll find video replays at the MS Society's website at nationalmssociety.org/MS-expert. And I'll remind you that every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you can take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. We're all witnessing that even during the pandemic, MS doesn't stop, and neither does the National MS Society. This webinar is just one example of how the MS Society has created virtual programming on the fly so that no one has to face MS alone. They've also created virtual support groups, provided resources and information about COVID-19 so that people affected by MS can get answers to their questions, and healthcare providers can deliver the very best care to their patients. The Society continues to amplify the voices of the MS movement to influence critical public policy decisions. And as we've heard today, they do all that they can to further the research that will find a cure. The National MS Society COVID-19 Response Fund has been established to ensure that the Society can meet the urgent and expanding needs of the MS community during these unprecedented times. And I'm asking you, as you're able, to support the MS Society's work by making a donation to the COVID-19 Response Fund. To donate, you can text the word GIVE to 68686, and you'll get a link right back that'll take you to the MS Society's COVID-19 Response Fund webpage. Or you can point your browser at the URL on your screen, and that's ntlms.org/responsefundcovid, and make your donation. So however you choose to contribute, please contribute today. It's never been more important. Now, I promised that we'd share all the ways for you to contact an MS Navigator with your questions. And you can find an MS Navigator on the Society's website at nationalmssociety.org. You can contact an MS Navigator by phone at area code 800-344-4867, or you can email your question to an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those social posts and subscribe to the channels. And you really want to make sure that you get on the Society's mailing list by signing up at their website. That way, you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. I'd like to thank Dr. Ellen Mowry for sharing her knowledge and insights with us today. And I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MS-expert. Now I have a favor. Getting your feedback on today's webinar is important. So do me a favor, you'll see a survey pop up in a moment when we close out the webinar if you're on GoToWebinar. If you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. It allows us to continually improve, and it helps shape future webinars. The survey only takes a minute, so please take a minute to fill it out. On behalf of Dr. Ellen Mowry and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.